next day, because today I am just dealing with a disease called gastritis in a small animal. For example, just like in pigs, in human beings, in canine and in feline. But in case of large animal, that is in bovine, cattle and buffalo, or in sheep and goat also, we have a separate types of stomach that is called abomasum, and their inflammation today we will discuss is abomasitis. So this is nothing but this is the same gastritis that we will learn in the next class about the canine. We'll just have a look at abomasitis, means inflammation of abomasum. Now, as the definition indicates, जैसा कि आपको definition लग रहा है, the inflammation of abomasum, although we will discuss in broad way the disease of reticulum, the disease of rumen and omesum in a separate way, but because this part, this is not the first part that the esophagus is in, this is the last part of the forestomach of the ruminants. But since it is related with, and in the next class, I have to teach the gastritis, the stomach, where the esophagus ends in a stomach, the different parts of the stomach. And therefore, I have taken this abomasitis as the first disease of the ruminants. Later on, I will teach the gastritis, and then the separate specific diseases that occurs in the forestomach, that is in the rumen and the reticulum, will be dealt separately. And they are very, very important from academic point of view as well as from practicing point of view. So you have to concentrate more on that disease. But since abomasitis is also a very important part of the abomasum, the inflammation of abomasum, we know the digestive system of the ruminants is slightly different. There is a high pH in the forestomach, in the rumen reticulum, but when it enters into the abomasum, it is just similar to human being or to the pigs, in which the pH drops down, where the pH is low. Therefore, you can compare the disease of this abomasum with the gastritis of the human being, or you can compare it with the gastritis of the canine and the feline. So what does this abomasitis means? It's the inflammation of the layer of the abomasum, and it's a sporadic disorder among adult cattle, calves, sheep, and goats. But unlike canine and feline, where gastritis is very, very common, if you see a case of a dog, 10 dogs, 4 to 5 dogs, if presented in a hospital, they are mostly suffering from gastritis because they have a habit of eating certain things. But in case of cattle, in case of ruminants, in case of sheep and goat, this is a sporadic disorder. It is very, very difficult to diagnose a case of abomasitis directly on the basis that because the ruminants never vomit. जिस तरह से छोटे जानवरों में खास करके कैट में या डॉग में हम गैस्ट्राइटिस को बहुत जल्दी एप्रिसिएट करते हैं, क्योंकि उसका सबसे बड़ा जो क्लिनिकल साइन आता है वो वॉमिशन है. बताया जाता है कि अगर कोई एनिमल वॉमिट कर रहा है तो हम गैस्ट्राइटिस समझते हैं, अगर डायरिया हो रहा है तो हम एंटराइटिस समझते हैं. लेकिन यहाँ पे आप इतना आसान नहीं होगा एबोमेशम के एबोमेसाइटिस में, खास करके कैटल में, बफेलोज में, सीप एंड गोट में, बिकॉज दे डू नॉट वॉमिट. द फर्स्ट लाइन, ये बात यहाँ पे याद रखना है कि कैटल वॉमिट नहीं करते हैं, सीप एंड गोट वॉमिट नहीं करते हैं, बफेलो वॉमिट नहीं करते हैं. ओके, इफ दे वॉमिट, really they are going to die. So this is the situation. Because of its anatomical nature, because of its anatomy, it is very, very difficult to create a pressure, negative pressure, so that an animal vomit outside. Because the true, you have to differentiate. So this is the difference between the true vomition, and sometimes you find some food is coming out from the mouth of the animal. That is different thing. That is called cud dropping. आप देखेंगे कभी कभी ऐसा केसेस आएगा. मैंने पिछले बार भी एक फोटो दिखाया था आपको, जहां पे ऑब्स्ट्रक्शन का केस था. आप सस्पेक्ट कर रहे थे ऑब्स्ट्रक्शन का केस, जहां पे जानवर, गाय का फोटो मैंने लगाया था, और वो खाना को चबा करके अंदर ले जाता है और कुछ देर के बाद उसको बाहर निकाल देता है. अगर ऐसा कंडीशन स्मॉल एनिमल में हो और वो फूड मिक्स हो तो हम उसको ट्रू वॉमिशन कर सकते हैं. सो यू हैव टू अंडरस्टैंड what is a true vomition and what is a false vomition. True vomition occurs in a monogastric animal, in which the food is coming out, the ingesta is coming out from the stomach. But in case of a large animal, but in the case of a ruminants, that is in cattle and buffalo, true vomissions never occurs, seldom occurs, and the vomition-like symptom that is occurring is just a cut dropping. वो एक कट ड्रॉपिंग है, चाहे वो ऑब्स्ट्रक्शन के कारण आ रहा हो, या फिर वेगस इंडाइजेशन के कारण आ रहा हो, या फिर किसी तरह के प्रॉब्लम के कारण आ रहा हो, that is coming out from the upper part of the GI tract, that is from the either from the esophagus. And if they vomit, if agar wo ek baar ulti karta hai, the animal mostly die because so much fluid is coming out and they are again aspirated back into the respiratory tract. And therefore, you will never find and you will never see that a cattle clinical sign that a cattle is vomiting. Honor sometimes will say, मेरी गाय उल्टी करती है, लेकिन आपको एग्जामिन करना होगा, देखना पड़ेगा कि गाय अगर उल्टी करेगी तो वो लास्ट पोजीशन में उल्टी करती है और वहां पे उसको बचाना बहुत बहुत ही मुश्किल हो जाता है. तो ये बात यहाँ समझना है. सो दिस इज ए स्पोरेडिक डिजीज. छिटपुट ऐसा होते रहता है, खास करके बछड़े में, भेड़ में और बकरियों में ये बहुत पाया जाता है. एंड इट इज caused by so many factors like dietary. It may be dietary in origin, it may be environmental in origin, infectious in origin, and some of them are parasitic. Some of the parasites are very, very important, that is responsible for producing inflammation in the abomasum, and therefore we will capture the name of the parasite that is responsible for abomasitis. So how you will appreciate that's the disease, because there is no true vomation, cattle and buffalo never vomits, so it is very difficult to clinically diagnose a case of abomasitis. So it is characterized by diffuse hemorrhagic necrotizing inflammation of the abomasum, mucosa, and ulceration. So this is only possible when you go for the postmortem and when you examine the GI tract, when you open the GI tract and when you see the abomasum, you will see the hemorrhagic lesion and necrotizing lesion on the abomasum, on the mucosa and the ulceration, and most of the time they are there. But it is clinically, it is very difficult to diagnose on the basis of vomition-like sign. But certainly the animal will show some sign. So abomasal ulcer, generally we deal abomasitis and abomasal ulcer in a similar manner, because there is only one line of differentiation. If the abomasitis remains for a certain period of time, कुछ दिन तक जब आप उसको हम नहीं ठीक करते हैं, that may be converted into ulcer, and you know the fate of a ulcer. If the ulcer formation is there in the abomasum, there is a leakage of blood from that region, and then the symptoms start coming out, and that the black passing of the black tarry colored feces, अलकतरे की तरह अगर उसका गोबर निकल रहा है, हम suspect कर सकते हैं it may be suffering from abomasitis or abomasal ulcer. So abomasal ulcer and abomasitis are dealt in a together manner, and just there is a line of a differentiation. Abomasitis is just inflammation. I will show the picture from a book I have brought here. So just a line of difference. And in case of ulceration, there is a leakage of blood from that region, and due to that, the feces become dark tarry colored. So abomasum and the erosion of the abomasal mucosa that develop in most of the viral diseases. The two very, very important viral diseases there in which abomasal ulcer formation occurs, that is bovine viral diarrhea and bovine malignant catarrhal fever. So just keep in mind, these are the two very important viral diseases. One is bovine viral diarrhea and another is bovine malignant catarrhal fever. So these are the two very important viral diseases that first produces abomasitis. Later on, it goes into abomasal ulceration. So generally, these abomasal ulcers are very common in especially in case of milk-fed calves, especially in case of calves, and you will find hemorrhagic diarrhea in calf that they have consumed milk and replaced her for 4 to 12 weeks. And most of these ulcers are subclinical and non-hemorrhagic. Sometimes these ulcers are also non-hemorrhagic. The blood is not coming out from them. So occasionally, the fed calves less than 2 week olds are affected, generally with hemorrhagic abomasal ulcer. And sometimes perforation occurs in the abomasum. And when there is a perforation in the abomasum layer, the leakage of the food material into the peritoneal cavity, and that may lead to peritonitis. So this is the sequence of this disease. If the disease is not treated properly and not treated in a time, that inflammation, it converted into abomasal ulcer, and there may be perforation in the abdominal cavity, and due to that, there may be induction of abomasitis. So abomasitis or ulceration are also common in high producing cattle. You know, most of the cattle that are producing 15 liter and 20 liter of milk, mostly they remain in a high concentrate diet. To increase the milk production, people used to give more concentrate, and they create a acidic media. So they create a acidic environment. And anyhow, if the cattle remains hungry, वो भूखा रह जाता है, आप उसको कुछ देर के लिए खाना नहीं देते हैं. आपको कभी कभी फील होता होगा जब आप टाइम पे खाना आप नहीं खाते, you will feel some pain in this region, some burning sensation in this region. So similarly, if the cattle, if they remains in a high acidic media for a longer period of time, that acid start working on their layer, on the layer of its abomasum also, and start producing lesion in this region, and that may first leads to abomasitis. Later on, it converted into ulcer, and then mostly this type of disease therefore is found mostly in the cattle that are in high producing, that are used for getting more milk. So this disease is very much common in case of cattle that are given large quantity of concentrate. So the mostly like cause a prolonged inappetence. And when you treat such type of animals, the owner will come, आपके पास गाय वाले आएंगे, आपके पास भैंस वाले आएंगे, आपको बोलेंगे सर हमारी गाय खाना नहीं खाती है, मैंने इसको बहुत दिन से ट्रीटमेंट कराया. अब आप यहाँ से सोचना शुरू करेंगे, बहुत सारे डिजीज आ रहे हैं जिसमें कि हमको डिफरेंशिएट करना पड़ेगा कि ये क्या बीमारी है, क्यों खाना नहीं खा रहा है. एक एपेटेंस, इनएपेटेंस, देयर इज अ लाइन बिटवीन इनएपेटेंस एंड एनोरेक्सिया. एनोरेक्सिया इज कंप्लीट लॉस ऑफ एपेटाइट, वो पूरा खाना नहीं खाएगा, बट इनएपेटेंस मन थोड़ा खाता है, थोड़ा नहीं खाता है. और ज्यादातर ऑनर यही कंप्लेन लेके आपके पास आएंगे कि आपको हमारे गाय को ये दिक्कत है. ये दिक्कत कितने दिनों से चल रहा है? 15 दिनों से चल रहा है, 1 महीना से चल रहा है, उसके स्टूल का कलर क्या है, ये सारी बात जब आप पूछ लेंगे, अभी when will come in the next slide. So if the cattle owner is saying that my animal is anorectic, is not taking proper feed is suffering from inappetence for a long period of time, you may suspect it to be a case of abomasitis, or it may suspect it to be a case of abomasal ulcer. So coming back to the etiology, as we have seen in most of the disease, we have etiology of physical, we have etiology of chemical, we have bacterial, viral, and parasitic diseases. So if any irritant substance like the lead, the battery, any types of chemical, if they're ingested by the animal, like the cattle, if they lick by them, they may produce some of the injury, like the chemical injury that produces. Suppose some foreign body sometime if getting dull, they may lead to physical injury. But mostly the disease in the abomasum is produced by the bacteria and mostly by the viral agent, as we have seen in bovine viral diarrhea. Even in the rinderpest disease, this was a very common pathognomic lesion in case of rinderpest also. That disease is already eradicated. But similar type of lesion you will find in case of PPR, in case of a goat. So in case of bacterial, in case of viral disease, PPR, rinderpest was there, which is now eradicated. In case of bovine viral diarrhea, in case of malignant catarrhal fever, you will find abomasitis. And some of the metazoans is that some of the fly that get engulfed and they form a small granular lesion in this abomasum, and that is responsible. And some of the other parasite also. So rinderpest, bovine viral diarrhea, and bovine malignant catarrhal viruses produce abomasum ulcerations and erosion. So this point is very important. Next is some of the bacterial agents, and we know so many bacteria are there, especially related with the Clostridium. So hemorrhagic enterotoxemia due to Clostridium perfringens type A, B, and C leads to abomasitis, and it may leads to abomasal ulcerations and malignant catarrhal, and it produce abomasal erosion also. So hemorrhagic enterotoxemia due to Clostridium perfringens type A, B, C are very important. Now some of the fungus like mucor, the aspergillus complicate this ulcer caused by other organisms. For example, the nematodal worm. हम लोग पढ़ते हैं वॉर्म्स में 3 तरह के वॉर्म्स के बारे में ज्यादातर हम लोग स्टडी करते हैं, ट्रेमाटोड, सिस्टोड एंड नेमाटोड्स, जिसमें कि नेमाटोडल डिजीज बहुत इंपॉर्टेंट है, ट्रेमाटोड भी और सिस्टोड्स भी इंपॉर्टेंट है. बट फॉर द रूमिनेंट्स, This nematodal worms are very, very important, and there are a long list of nematodal worm in which some of the important worms that leads to abomasitis, that leads to a severe anemia in case of a small ruminants as well as in large animals, is Trichostrongylus, Osteotagia, and then Haemonchus. You might have learned the name of Haemonchus contortus. This is highly pathogenic worms of the sheep and goat. So some of the nematodal worms that may produce lesion in the abomasum as well as they may produce lesion in the small intestine is responsible for producing abomasitis. Just you keep in mind. So these are some of the nematodal worms that are responsible for abomasitis. Now, as we are talking of the metazoans, metazoans are the agents that, like a fly, that invade the oral cavity. उसके अंदर जाता है and produce a massive infestation like the bot fly larva. It produces gastrophilus, Hebronema musi, and Hebronema microstroma. So these are some of the fly that enters into the oral cavity of the ruminants and produces this granulomatous lesion, एक गोल जैसा आकार का, एक गेंद के आकार का एक lesion, ulcerative lesion वहां पे produce करता है, और ये लगेगा कि कोई ट्यूमर जैसा ग्रोथ हुआ है वहां पे, and that it may also lead to perforation of this abomasum, and when there is a perforation of the abomasum, there is an induction of peritonitis because the food particles start coming out from abomasum into the peritoneal cavity. So this is the pathogenesis of this. Now coming back to the clinical finding, as in most of the disease, because it is a painful condition, abomasitis, there may be abdominal pain, there may be reduced appetite or inappetence, and animals show excessive thirst. Now this is a very, very important line, intermittent occult blood in the feces. So when you see the feces, sometimes feces will be normal, and sometimes you feel a small bots of blood mixed with the feces, and they can die acutely from, and sometimes massive hemorrhage occurs in the GI tract. Excessive hemorrhagic diarrhea occurs in the GI tract, and it is in that condition, it is sometimes animal may die. So common clinical signs include mild abdominal pain, sudden onset of anorexia, fecal occult blood, or melena. So this line is also very, very important. This term I will use for in many diseases. Melena. The melena is a digested blood. It's the passing of dark tarry colored feces. जो feces animal का होता है, उसको आप जब देखेंगे तो लगेगा कि अलकतरे की तरह काले रंग का अगर स्टूल आ रहा है, खास करके ruminants में, वो indicate कर रहा है कि there is some blood leakage in the upper part of the GI tract. Now you have to make a differentiation. If the blood is coming from the upper part of the GI tract, that blood get digested in the system, and in that condition, the black tarry colored feces is coming. But when the blood is coming from the latter part of the GI tract, the fresh blood comes out in the feces. That is called hematochezia. So you have to make a differentiation on the basis of the color of the feces. आप स्टूल को देख करके, feces को देख करके बता सकते हैं कि ये यहाँ पे hemorrhage कहाँ होगा. So because the abomasum is in the upper part of the GI tract, from there, if the blood is leaking out from the abomasitis, or if from the abomasal ulcer, or from some lesion, like I have told in case of bot fly lesion, so in that condition, the blood that is oozing out get digested in the GI tract, and it shows a black tarry color. So melena, the passage of melena indicate that the ulceration or the abomasitis that is present in the upper part of the GI tract. However, if the leakage of the blood is from the lower side, that is towards the large intestine, that indicates that sometimes the fresh bloods may be mixed with the mucus or with the feces. So in that condition also, in abomasitis also, the pale mucous membrane are there because the animal start losing blood and anemia may develop, and therefore when you will examine the mucous membrane will appear whitish in color, the weak pulse is there, extremities become cool, and tachypnea and melenas are the other clinical signs. But in more severe include acute rheumastasis, and if this condition is more, the movement stops. Rheumastasis occur, generalized abdominal pains, even the animal shows reluctance to move. The animal, because of the pain in the abdominal cavity, the animal will show grunting movement and a growing movement, just like even I have told the different posture of the animal, lordosis, kyphosis, and scoliosis. Animal will show weakness, and there will be dehydration. So dehydration is one of them, a feeling of abdominal pain in the animal, and grunting sound will found when the animal इस तरह का आवाज कर सकता है. So malaria may be per acute in cases, but sometimes abdominal blood is detected in the feces also. So as the condition progresses, body temperature drops and animal becomes recumbent and dies between. If these symptoms are not addressed, sometimes death may occur in case of abomasitis. So these are some of the from a book, because I don't have a picture of abomasitis. This must be found in calves in which hemorrhagic diarrhea is there. So in case of calves, and you see how the hyperemic this abomasum has, and there are two perforations. Sometimes the perforation is also found in case of abomasitis. So how you will diagnose? Your basic aim is diagnosis. First, you have to depend upon the history of prolonged anorexia. I'm talking of prolonged anorexia because in the next class, I will talk about just a simple indigestion. The simple indigestion is very, very simple. And when we not able to understand and differentiate the simple indigestion from other diseases, then we make a mistake. So in the next class or in the following class, we will talk about the simple indigestion in ruminant. That is a different type of disease. But here there will be a prolonged anorexia. बहुत लंबे समय से खाना खाने का दिक्कत रहेगा. There will be abdominal pain as evidenced by reluctance to move, grunting sound, change in the posture. So these are some of the history the owner will explain to you. So these are the two very important found. Now you have to absorb melena and occult blood in the feces. And at the same time, when you will go for hematology, the hemoglobin level will be down and the PCV level will be low. So these are the two, some of certain indirect indication that something is happening in the GI tract, and therefore that the hemoglobin level is very, very low and the PCV level is low. So we have to go for the fecal examination for the check of any of the nematodal bomb. Otherwise, you have to depend upon the fecal culture for bacterial and the viral isolations. Now, our basic role is whatever the cows may be, first you have to treat the cows. If you suspect if it is a case of bacteria, go for a broad spectrum antibacterial agent. Either if it is a case of bovine viral diarrhea or malignant catarrh fever, they are the viral disease. There is no direct treatment for the virus, but you have to treat the secondary bacterial infection. In that condition also, you have to use antibiotic. So with the antibiotic, you have to use the gastric protectant. Now I will teach in 2 and 3 class regularly because these are the mostly cases coming to our clinics either in a small animal or a large animal. So I will talk about 2 and 3 therapy, very, very important. The first, we people are also using antacid. And what is an antacid? Why use antacid? Sometimes we will use the gastric sedative that antacid contains, like the magnesium hydroxide, like the carbonate, like the kaolin, like the pectin, or like the charcoal. So these are the substances that make a layer on the GI tract, especially on the abomasum. उसके ऊपर एक सतह का एक लेयर बना देता है और वो जो एसिड जो वहां पे जाके एक्ट कर रहा है उससे उसको प्रोटेक्शन प्रोवाइड करता है. And as well as at the same time neutralize the preformed acid, the acid that is accumulated in the abomasum. They neutralize the acid as well as they protect the layer of the abomasum, layer of the fruit, so that the acid, all the other irritants are not acting on their muscular region. So this is the concept of using antacid. Antacid is used when there is a chance of acidosis, there is a chance of preformed acid formation. If the animal is anorectic for a very, very long time, certainly there is accumulation of acidic substances in the abomasum. So to neutralize that, we have to use antacid. That antacid contains sedative things like the many sedative substances so that some pains may be relieved. For example, insoluble magnesium hydroxide. We use sometimes a very soothing agent like the kaolin and the pectin. These are the Indian pharmacopoeia drugs is still available in the market, and most of the Ayurveda-like drugs that contain kaolin and pectin, and even we can go for the charcoal. So these are some of the medication we use for the treatment of this abomasitis. Now we can also use, although these types of H2 blocker or proton pump inhibitor, like sometimes when you feel a hyperacidity, doctor used to give ranitidine, cimetidine, Esiloc injection. So many trade names are there. or sometimes we go for pantoprazole, we go for omeprazole, similar type of, to decrease the secretion of the acid from that region, we use either H2 blocker or we can use proton pump inhibitor. So these are the medication generally we use for the systemic with the through injection, because in case of ruminants it will cause large amount of these types of tablets or the bolus, and they will degrade it in the like in the rumen and reticulum. It is very difficult to go and pass through this and then to put it in the abomasum, and therefore this type of medications we use either through intramuscular route. So H2 blockers and proton pump inhibitors are used, and at the same time, because the animals are anorectic for a very, very long time, we go for fluids and electrolyte therapy. And I think most of you have gone through fluids and electrolyte therapy in case of ruminants. You are reading systemic states in which dehydration, hypokalemia, hyperkalemia, hyponatremia, all might have taught by Dr. Vipin sir, and which he might have told you if the animal is anorectic for a long time, this types of fluids is required. If the animal is suffering from hyponatremia, means low sodium content, then you go for this types of fluids. If the animal required glucose, then we go for DNS-like solutions. So dextrose normal saline solution, Ringer's lactate solution. So these are the common isotonic fluids available in the market. We go on the basis of dehydration. If the animal, we judge the dehydration on the basis of tenting of skin, उसके skin को उठा के देखते हैं, अगर skin बहुत देर तक fold बना के रखता है, sunken eyeball condition दिखाई पड़ता है उसमें, हम मानते हैं कि जानवर में पानी की बहुत कमी है उसके शरीर में, उसका हम फिक्स कर सकते हैं कि ये कितना 5% से सफर कर रहा है डिहाइड्रेशन से, 7% से सफर कर रहा है, 10% से सफर कर रहा है, या मोस्ट सीवियर 10 से 12% से सफर कर रहा है, और उसका एक एवरेज वेट लेते हैं, उससे मल्टीप्लाई कर सकते हैं परसेंटेज ऑफ डिहाइड्रेशन से. सो दैट गिव्स द अमाउंट ऑफ फ्लूइड रिक्वायर्ड फॉर ट्रांसफ्यूजन. सो उतना फ्लूइड, अब हम कल्पना करेंगे कि कभी आपको पढ़ाया गया होगा कि एक 300 किलो की गाय का अगर हम सोचें, अगर 10% डिहाइड्रेशन से सफर कर रहा है, तो उसको लगभग 30 लीटर फ्लूइड का रिक्वायरमेंट होता है. तो वो हम दे नहीं पाते. अगर आप एक बार प्रिस्क्रिप्शन लिखेंगे कि 30 लीटर फ्लूइड, कभी कभी ऑनर समझते हैं कि पता नहीं डॉक्टर ने 30 लीटर फ्लूइड क्यों लिखा है, बट दिस इज द रैशनल ऑफ गिविंग फ्लूइड्स इन केस ऑफ एनिमल विद इन 24 आवर्स. That animal required this amount of fluid if it is suffering from sunken eyeball condition, if it is suffering from tenting on his skin more than 30 seconds, 30 सेकंड से ऊपर तक उसका स्किन फोल्ड रहता है, वो सीवियर डिहाइड्रेशन से सफर कर रहा है, और इस समय हम उसको ज्यादा से ज्यादा अमाउंट फ्लूइड देते हैं. छोटे जानवरों में तो दे देते हैं क्योंकि उसमें ज्यादा, अगर हम उसके बॉडी वेट, सपोज अगर एक पिग है, pig also suffer from, is a monogastric animal, but it not suffer from abomasitis, but it will suffer from gastritis. But if there is a dehydration, if the weight is if the weight of an animal is 50 kg, just you multiply the 50 kg by 10%, you will get a low amount of 4 to 5 liters of fluid. Similarly, in case of dog and cat, if the animal is 10 kg, it will require half liter to 1 liter of fluid. So this is the method of calculation of the amount of fluid to be required in case of most of the gastritis or in abomasitis cases. In some of the time, when you feel that an animal is not recovering and showing a sign of peritonitis, peritoneum, and certainly some perforation chances are there, in that condition, medicinally it is not going to recover. For that condition, you have to go for the surgical intervention. And again, you have to give antibiotics to prevent it from developing into a severe peritonitis. The animals, but the best thing is that if the animal is suffering from abomasitis, if the animal is suffering from a very, very long time, go for fluid therapy, go for all type of gastric sedatives, go for proton pump inhibitor, but at the same time, encourage the animal to eat something to avoid prolonged period of inappetence. If the animal remain in inappetence for a very, very long time, there is a loss of flora, and the pH of the abomasum is very difficult to control. So in that condition, to check the pH, to increase the pH, your lower abomasal pH, we have to induce the animal to go for this type of therapy. To induce the animal with the treatment, you encourage the animal to eat something. If the animal start eating, then it will interest in from remove from inappetence in anorexia, and sometimes we can use to speed up the recovery of the patient in case of abomasitis. So I think we have covered